Hello and good day. My name is Dr. Mim, and for those of you that don't know me, I'm a medical doctor practicing here in the UK. So as I'm sure you all know, unfortunately Markiplier Fishbuck has ended back in hospital again with what he is saying is another bowel obstruction. If you don't know what I'm talking about, I'll add the links to his videos in the description below just to get some context as to what I'll be talking about. And first of all, I just want to say, Markiplier, I hope you get better really soon. You look like you were doing a lot better in the second video that you uploaded, and hopefully things will continue to improve and you can get well enough to be discharged home very soon. But I just wanted to make this video to kind of answer a few questions that you guys might have about exactly what it is that he's suffering from, some of the treatments that he might be going through at the moment in the hospital, and what's caused all of this in the first place. And just as a disclaimer, everything I'm about to say is very generalized and not necessarily specific to Mark's situation. Obviously, I don't know any specific or exact details about what he's going through in the hospital, so this is just going to be generalized information about what someone who might have something similar to Mark could potentially be going through. So first of all, what is bowel obstruction? It can occur in the small or the large intestine, the small intestine being the food tube connected to your stomach, the large intestine being the poop tube connected to your butthole. Our bowels are constantly moving to push food through its system by a process called peristalsis, where the muscular walls of the bowel will squeeze and contract in such a way as to push a bolus of food through its lumen, the lumen being the space inside the tube, not to be confused with lumens, which is a measure of light intensity. And an obstruction is when, for whatever reason, this process gets interrupted, either by a blockage within the tube itself or in the walls of the bowel, or something outside the bowel adding pressure or pulling it in such a way that blocks the passage of food or poop. And in all seriousness, a bowel obstruction is actually a very severe surgical emergency, and it needs to be dealt with very quickly in order to avoid any more serious complications, which could include things like a bowel perforation, where your intestine can quite literally burst because of the pressure, and that can lead to something called peritonitis, which is a severe infection of the abdomen because of the leaked fluids from within the gut. And it can also lead to something called ischemia, where the part of the bowel affected has a reduced blood and oxygen supply, which can lead to cell death of that part of the bowel. It's definitely not something to be taken lightly at all, and it's something that requires urgent hospital assessment very quickly. And as this is not Markiplier's first rodeo with bowel obstruction, I'm sure he knew what to do straight away, and it looks like he got the care that he needed very early on, which is definitely a good thing in terms of prognosis. So what are some of the symptoms you can get with a bowel obstruction? Well, it kind of depends on where exactly the obstruction is, but in general you can expect severe abdominal pain, feeling sick, vomiting, swelling of your abdomen, being unable to poop or even fart. It's easily distinguishable from your common stomachache because of just how severe the symptoms can be. When he arrived at hospital, Markiplier would have had some blood tests, he would have had a plain film x-ray of his abdomen. Some people get CT scans, but most obstructions can be seen on a plain film x-ray. So what kind of treatments could he have had? So the mainstay of treatments for intestinal obstruction is something that we call drip and suck. And what that means is that we give IV fluids through a cannula in a vein, most likely on his arm or hand somewhere, and we use an NG tube to suck out some of the contents of his stomach to relieve the pressure in his intestinal system. You can see in Markiplier's first video that he had that really thick NG or nasogastric tube in his nose, and it's called nasogastric because it goes in through the nasal passage, through the back of the throat and down into the stomach. There's different types of NG tubes. We have thinner ones for introducing things into the stomach like food or medication, but for taking things out you need more of a large, wider bore tube. Some patients will also need to have a urinary catheter put in place so that we can monitor their fluid input and output very accurately. And of course he'll need some analgesia or pain relief because of the severe abdominal pain that we talked about earlier, and this is most likely going to be in an intravenous form, so something into his veins rather than like a tablet, because at this point he's most likely going to be kept nil by mouth or nil per oral, NPO, you might have heard of that before, and that's because he might need surgery at some point with this obstruction. So why has this happened, and what actually causes a bowel obstruction? There's actually many different causes of an obstruction. As we mentioned earlier, it can be something that's blocking the inside of the tube or in the wall, or even something outside. We know in Mark's situation he has had some previous bowel surgery for a benign tumor, I think it was, quite a while ago, and anytime you have some form of abdominal surgery, it can lead to something called an adhesion, where the scar tissue within the bowel can stick together and can cause things like an obstruction by adding pressure to the outside of the bowel wall. Most of the time these adhesions occur quite soon after you've had the initial surgery, but they can occur at any point afterwards. Some other things that can cause bowel obstructions are inflammatory bowel disease, so Crohn's disease is something you might have heard of, where you can get a lot of inflammation and it can make things quite sticky within the bowel loops. There's also some more rarer causes, things like cancer. I'm sure at this point the doctors looking after Mark would be investigating for all of these causes just to kind of rule out anything that they might have missed that might be causing a recurrence of his bowel obstruction. So what's a prognosis for a bowel obstruction? Well, it really does depend on where exactly exactly the obstruction is, whether it's in the small intestine or in the large intestine, what's caused it, whether it's something simple like an adhesion or something maybe a bit more complicated like a cancer. And it also depends on whether or not there's been any complications like some of the ones that we mentioned earlier. So whether or not there's been a perforation of the bowel, whether or not there's been any ischemia to the part of the bowel affected by the obstruction. But without any of these complications, and if the cause is something relatively simple like an adhesion, if the patient seems to be improving in about 24 to 48 hours, we can generally expect them to make a good recovery. We would regularly check up on them to see if they're able to poop or fart. That is actually something really important that we would check quite frequently, because it would indicate that the bowels are actually working like they're meant to again and allowing things to pass through. So like we saw in Markiplier's most recent video, he does look like he's doing a lot better. He doesn't have that NG tube in anymore. So all we're waiting for him now is just to take a shit. So once again, Markiplier, I wish you the swiftest of recoveries. I hope you get better soon. Push that poop out quick so the doctors can send you home back to your loved ones so you can carry on doing what you love to do. But please take some time off when you get home. Have a break. Don't rush it. We'll all be here waiting for you. Relax. Don't stress yourself out too much. You've had something serious. You need to rest. This is a doctor telling you need to rest. And thank you to all of you for watching. I hope this helped to be a little bit informative and answer some questions that you might have had about Markiplier's condition. Take care, guys. Stay healthy, and I'll see you in the next one. Bye-bye.